Welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about Celecoxib. Complicated? Better known as Celebrex. That's what we all still say in practice. Even though it's gone generic, we still all just say Celebrex. It's easier that way. It is used for all different kinds of arthritis. So we're talking about gouty arthritis, we're talking about rheumatoid arthritis, osteoarthritis, all the way to any kind of acute pain scenarios. Pain due to cancers, sports injuries, nerve pain. This drug is just so versatile, it can be used for a lot of different issues in that sort of realm of pain. Let's see here. And off-label, it's used for gout as well. Off-label meaning it's not FDA indicated for that use, but they've seen that in practice it helps with issues of gout. So you can use it there as well, again, under a doctor's supervision. I won't go over dosing. Dosing, it just varies so much. The strength varies so much. And it all depends on what you're using it for, so I'm not going to touch dosages. That's for your doctor. I'm going to leave it there. Very easy. You can take it with or without food. Not big deal. If you do take it with food, you kind of want to avoid a high fatty meal just because it'll kind of delay absorption and hitting your peak times and all that. So you just want to eat something kind of light if you do eat with it. But again, no big deal even if you do chow down half a pizza with it or something. So no big deal there. Let's see here. There's quite a bit to talk about. So how does it actually work? So I am trying to, I thought long and hard about how to explain this without getting too scientific. So there is a COX prostaglandin, there's a whole pathway to pain. And essentially, I don't want to go through any of that with you because I think it's just too complicated. I don't think it's easy to understand. But I will tell you how it's different from other medications that are just like it. So this is an NSAID, a non-steroidal anti-inflammatory. Chances are you've probably seen that in places. If you go into your medicine cabinet and you see that bottle of Aleve or Advil, ibuprofen or naproxen, as they're known in generic terms, those are NSAIDs, non-steroidal anti-inflammatory. And so the good thing about those is that they're pretty good at hitting all different generic types of pain. What makes Celebrex different from these is that it's selective only to tissue pain for the most part. Or specific pathways of pain in the COX-2 category. Again, I don't want to throw the complicated stuff at you. Essentially, when you take an Advil or an Aleve, it goes into your body and it hits everything, right? It'll get to your hands, your feet, your legs, and it doesn't, even though there's no inflammation there, it still hits it. And so, you just hope that when you take the Advil, enough will get to the area that you need to get it to. With Celebrex, it's kind of more specific. It's targeted, which is why it's more effective. I'm not going to say it's stronger. That's kind of a very misleading term whenever we talk about pharmaceuticals. It is more effective at hitting what you need it to hit, right? So if you have some sort of nerve pain, it's better at hitting that nerve pain. Or if you have some sort of tissue injury, it is going to be better at hitting the specific tissues than your standard NSAIDs, right? Like diclofenac, Advil, Aleve, whatever. And also, one great thing about this medication is NSAIDs are generally linked to a lot of stomach issues. It really, really screws with people who have acid reflux and even some that don't. Celebrex, on the other hand, is for people with acid reflux issues because it won't cause all those GI issues. I mean, it'll still cause some, but not to the extent that, like, the other guys will, which is what makes it more effective, which is why it's one of the newer classifications of those kind of NSAIDs as we've been talking about. If you have hepatic or renal impairment, right, your kidneys or your liver are damaged in some way or they're not as good, make sure your doctor knows. They should. The reason why I constantly mention whether you have hepatic or renal issues is a lot of people use different doctors, different specialties, and so sometimes we don't communicate well in the healthcare industry, right? So maybe your liver doctor isn't talking to your PCP and you come into your PCP about something that just happened to you. You got into a car accident or, you were playing and you got hurt. Then they put you on this and then meanwhile your liver doc doesn't know and you have a liver issue. So, make sure that all of your doctors are in on the loop as far as what you're taking and what disease states you have going on. It just makes it just safer, right, moving forward, because these things are dangerous. And in the wrong hands or in the inadequate educated hands, these medications can cause harm. So if one doctor doesn't know that you've got this so-and-so going on and you take this medication, it's harmful. So just make sure everyone knows, everyone's on the same page. This way we don't prevent any damage to you, right? That's the whole point. We want to make you better, not worse. Let's see here. So if you are pregnant or going to be soon to be pregnant, I don't really want to mention this, but it hasn't been linked, nor has it been confirmed that there could be some sort of birth defects while on this medication. So I'm just not going to talk too much about that. The evidence has been really conflicting. Just talk to your doctor if you're going to be taking this medication, you're about to get pregnant or you are pregnant. It's just a better conversation for them to have with you rather than me just throwing it over like a YouTube video. It's just not right. For those that are lactating, this is excreted in your breast milk, so make sure that your doctor knows. You guys have a conversation about this on how to proceed forward, if you need to be changed to a different medication or not. Here are the common side effects of this medication, listed up right here. And for the most part, this medication is really well tolerated. People don't have a problem with it. The only big issue is, and then again, this is an issue depending on your insurances, but the cost tends to be kind of an issue with this medication. It's on the newer side. So it's generally not the cheapest drug. But again, that's so relative depending on what insurances you have and whatnot. But otherwise, we've seen majority of the population tolerate this really well, and they really like this medication. That's the big key. They really, really do like it. It's a great medication. And I think that's it, guys. If there's something I left, I may put it at the end of the video. But again, as always, thank you for tuning in. I hope these videos help. Please leave comments below. Let us know how to improve these videos, right? These are just for you guys, right? We want them to help you. And if they're not helping you, then, you know, what's the point of making these videos if they're not helpful? So again, thank you so much. If you have in-depth questions, please forward them to your doctor or your local pharmacist. We're great resources and tools. If you would like to contact us personally at Telfer Specialty Pharmacy, by all means, please do. We'd love to talk to you about it. And we'll see you next time on Meds Made Easy.